Hello and welcome. My name is Jayson Ray Abellar and I am a second year nursing student at Southwestern University, Finland. In this video, I'll be demonstrating bag technique. But before that, let's tackle what is bag technique. Now, bag technique is a tool by which the nurse during his or her visit will enable him or her to perform the nursing procedures with ease and deftness to save time and effort with the end view of rendering effective nursing care to clients. Now, keep in mind, when performing bag technique, it will help minimize, if not prevent, the spread of any infection. It also saves time and effort in the performance of nursing procedures. The bag technique can be utilized in a variety of ways, depending on the agency's policy, the home situation, or as long as the principles of avoiding transfer of infection is always observed. Now, the public health bag is an essential and indispensable tool of a public health nurse, which he or she has to carry along during his or her home visits. Now, it contains the basic medication and articles which are necessary to give care. Now, the contents of a CHN bag are paper lining, extra paper for making waste bag, plastic linen, apron, hand towel, soap in a soap dish, thermometers, 2 pairs of scissors, surgical and bandage, 2 pairs of forceps, curved and straight, disposable syringe with needles, hypodermic needles, sterile dressing, cotton balls, cord clamps, micropore plaster, tape measure, 1 pair of sterile gloves, baby scale, solutions of betadine, 70% alcohol, hydrogen peroxide, and spirit of ammonia. Note that the BP apparatus and stethoscope are carried separately and are never placed in the bag. And now for the demonstration. Upon arrival at the patient's house, place the bag on the table lined with clean paper. The clean side must be out, while the folded part touches the table. Now, this protects the bag from being contaminated. Keep in mind that the bag must be clean at all times and it is considered sterile. Now, ask for a basin of water or a glass of drinking water if there's no tap water. This will be used in hand hygiene. So, open the bag and take out the soap and the towel. This is for preparation for the hand hygiene. Now, wash hands using soap and water. Use towel to dry. But I'm going to substitute with using alcohol at this moment for hand hygiene. This prevents the spread of infection from the healthcare provider towards the client. Now, take out the apron from the bag and place it or put it on the right side. Now, this protects the nurse's uniform. So, put out all the necessary articles needed for the selective care. This way you can have them accessible. Now, close the bag and place it one side of the working area. Again, this helps to prevent contamination. And also, if you do have a waste receptacle or a waste bag, it's also important to have them on the go. Proceed in performing the necessary nursing care treatments. This helps the client feel comfort and security. It also hastens the recovery. Now, after giving the treatment, clean all the things that were used and perform hand hygiene. This prevents infection for the caregiver or towards the caregiver. Now let's assume I have cleaned all the articles and perform hand hygiene. You also need to throw out the waste. So, open the bag and place all things in their proper places. After hand washing, of course. Sorry. Remove the apron, folding it away from the person, soiled side in and clean side out. Now's the time to fold the paper lining. And place it at the top and close the bag. Now's the time for making documentation. Now, take the record and have a talk with the mother. Write down all the necessary data that were gathered, observations, nursing care, and treatment renders. Give instructions for care of the patients in the absence of the nurse. You may also make appointments for follow-up care. Be sure to take down notes for date and time. Now, this is the last part of the demonstration video. Thank you for watching.